Introductions. The factors that drive the pricing of hotel rooms across the globe become more pronounced during a downturn. Still, the ways in which those factors plays out have shifted due to the COVID-19 pandemic, a crisis like no other hotel industry has experienced. While greater in magnitude, some of those shifts are already following patterns established in past downturns. But time will tell if other changes will be longer lasting or even permanent. Staffing reduction, hygiene, and safety consideration played the most part in the changes in hotel room rates, especially during the pandemic. Hotel cleanliness and hygiene have become particularly silent as of late because of COVID-19 can be spread by touching surface contaminated with the virus. Hotel surfaces are likely to be dirty, contain higher microbial counts, and yield potential sources of diseases transmission. In addition, aerosol transmission via central air condition could be another route of COVID-19 infection. Due, the, due to the COVID-19 outbreak, travelers will likely patronize hotels that offer reassuring lodging services and accommodation products regarding hygiene and cleanliness. To this end, hotels should implement regular hygiene surveillance at facilities via manual and automated robot practices. Given the cleaning robots nowadays are endowed with sensors measuring the quantity of dust in a specific area of a hotel and either work more than an area or generate data that can be useful for the cleaning teams. Future research could investigate how hotels cleaning staff should collaborate with AI driven robotics to achieve hygiene and cleanliness goals. In addition, hotel, restaurant, and other departments should emphasize their commitment to safety and hygiene protocols and high housekeeping standards. This assertion appears to be supported of Hang El at 2018 in the research on how hotels in Hong Kong responded to the SARS H1N1 swine flu crisis. In particularly, they found that hygiene surveillance at the hotel facilities may help mitigate the impact of infection disease. Guest room cleanliness, example is the bedroom and bathroom, is a core component of hotels' reputations. Many studies have considered overall hygiene and cleanliness as a principal department of travelers' guest satisfaction, guest delight, and guest loyalty. However, scholars have rarely considered the hygiene and cleanliness of specific areas in a hotel. The present paper does recommend that the research move beyond typical perspective on the antecedents and outcome of hotel hygiene and cleanliness to delve into guest participation of the cleanliness of hotel surface. Example is key cards, bed lines, light switches, and TV remotes, and other areas. As noted, hotel surface receiving requirements human contacts are more likely to be contaminated through touch and became more sources of transmission of infectious disease such as COVID-19. Areas that, areas that are out of hotel guest reach such as central air conditioned system may also facilitate the aerosol transmission of viruses. A more granular understanding of hotel cleanliness will assist hoteliers in streaming their housekeeping procedures to ensure effective cleaning and sanitation of hotel properties. Given the growing consumer demand for hotel hygiene following the COVID-19 outbreak, enhanced cleanliness and sanitation to prevent or limit the spread of disease can be promoted as a selling point during and after this pandemic. They found that younger travelers and women of all ages will be willing to pay premium for enhanced guest room disinfection. Based on their work, future researchers should examine whether different hotels' guest surgeon willingness to pay premium for enhanced sanitation has been changed amidst the COVID-19 pandemic. Additional, as a very higher cleanliness may require investment in technology, equipments, and resources. Future studies should also consider To that extent, different types of hotels should improve their sanitation practices. The notion of hygiene can be extended beyond sanitation to compass broader aspect of healthcare. Customers are likely to become more concerned about general healthcare access, with planning tips following the COVID-19 pandemic, such as seeking medical care if they fall ill. On a personal level, guests tend to prioritize their health and hygiene, such as through a healthy diet and healthy hygiene, as lines of defense against disease. Hotel-centric healthcare considerations are thus discussed in the following sections. Amid the COVID-19 pandemic, many people have begun to consider their lifestyle and focus on the physical and mental well-being, considering their newly prominent consumer need. Helping guests lead a healthy lifestyle could become a post-pandemic trend for hotels. For example, meditation program, digital deluxe program, fitness program, nutritional diet program, and sleep hygiene program are likely to become more popular in hotels' marketing mix. Under these circumstances, it appears desirable to investment further how hotels can design personalized product to enhance guest well-being and improve the guest experience. Especially, research could consider how to leverage guest behavior data and their consumption history. Human health originates from the health of nature. The COVID-19 pandemic has forced humans to acknowledge the importance of nature and the ecosystem. It is the predicted environmental friendly forms of tourism such as ecotourism and slow tourism will become more popular after the COVID-19 pandemic. Travel from contribution to environmental sustainable and harmony between people and nature. Accordingly, hotels should accommodate this public sentiment by formulating eco-friendly strategies and green practices in response to travelers' concern to the environment. On an aggregate level, studies should seek to extend the literature of guest perception of green hotel attributes by investigating why and how this perception differ across hotel categories and travel purpose. There is also a need to explore opportunities for hoteliers to collaborate with guests in co-creating the green value. Due to the global health crisis caused by COVID-19, travelers are now likely to pay more attention to the available and quantity of medical facilities when making travel decisions. This consumption need is especially pertinent for hotel properties in gateway cities, particularly those receiving frequent convention business. In this sense, key areas to be addressed by future research include how hoteliers should design marketing communications, content, and use marketing communication tactics to showcase their abilities to protect guests from public health crises, assure guests of health and safety during their stay, and make them feel more at ease following the COVID-19 outbreak. Additionally, in a public health crisis such as COVID-19 pandemic, the virus is transmitted between guests and hotelier service employed and between guests themselves. Hence, a future researcher direction centers around whatever and why technologies such as AI and AI-driven robotics could guarantee social distancing among hotels. Guests in time of epidemics and how hotels could institute effective physical distancing measures among guests. Relatedly, research has determined the various attributes and benefits of medical hotels that specialize in providing healthcare services in a hotel setting by offering medical resources. In this vein, it would be worthwhile to explore how specific medical hotel attributes can be incorporated in other type of hotels to offer greater value of guests, considering whatever these healthcare related features might influence the traveler's decision-making process and how such influencer may vary in the socio-demographic aspect. Furthermore, given the potential importance of hotels in this disaster risk management, a more in-depth analysis is warranted about the developing relationship between hotels and the hotelier sectors. For example, research could gather empirical evidence from the various stakeholders and discuss the feasibility and effects of using hotels as quarantine sites during a pandemic health crisis. This session aligned with with the study about the collaboration between the hotel industry and the hotel government for disaster risk reduction in coastal destinations. Especially, the research reveals that the hotels can contribute to disaster management by offering evacuation sites and other term refuge. With this, the researchers aim to first determine the reason why behind the changes in room rates in the few hotels during this pandemic. Second, determine why the changes are necessary. Next, determine the effects of the pandemics on the hotel sales. Determine the variable that affect the management decision to change the hotel's room rates. And last, determine the decision of the hotel's management brought significant effect of the hotel.